I did research over the binge eating disorder, which I found resources from Wardlaw's contemporary nutrition textbook, as well as the Mayo Clinic website. All right, so binge eating disorder is a serious eating disorder in which you frequently consume unusually large amounts of food and feel unable to stop eating. So there's a sense of lack of control with this disorder. And almost everyone overeats on occasion. I mean, I overeat. I'm a big eater. I like to eat, you know, a lot of food. But with binge eating disorder, it's more of a regular pattern and regular routine and eating large amounts of food within, you know, a 2 hour short time period. So, if you see someone just eating, a whole pizza within 2 hours and doing that consistently, then there's probably a high chance that they have binge eating disorder. Also, with this disorder, a lot of people become overweight and obese because they're eating a lot of food and they're not, eating the normal amount of food and calories that they should be putting into their body. Also, with this disorder, 3.5% of women have it. College-age women have it, 4%. And men, 2% of men have this disorder. Let's look at some of the symptoms. Some of the symptoms include frequently eating alone or in secret, so you're eating in isolation, taking food to your room like McDonald's and just, eating a lot until you're really full, but then you keep on eating, so it's just really bad for your stomach and, trying to maintain a healthy weight. Also, feeling that your eating behavior is out of control. A lot of people feel this who have this, that, it's not within reasonable means. Eating when you are full or not hungry. Eating rapidly during binge episodes, so you're not taking your time to eat your food, but you're just really scarfing it down. Also, eating until you're uncomfortably full. Feeling depressed, disgusted, ashamed, guilty, or upset about your eating. Frequently dieting. So, after you eat a lot, you want to diet so you can try to lose weight because you kind of feel guilty that you ate a lot. So that's definitely a part of this disorder. And the thing is, binge eating usually doesn't get better by itself, and you need to get treatment if you know that you have it. Kind of going off of that, the binge eating disorder was first officially described in 1994. Binge eating disorder is a growing, complex, and potentially serious problem. The causes are unknown, actually. So doctors and people can only guess that it is genetics and biological factors which kind of tie into your family history with the disorder, and if they had it, then you're more likely to have it. So you just have to look at your parents and grandparents and know their family history and their health history to kind of see and get a feel for if you would have a chance to get this disorder as well. Also, long-term dieting. So if you're trying to diet for a long time, they can be a cause if the diet isn't working out. And psychological issues. So if you have a psychological issue, then that puts you at a higher risk of binge eating. Some more risk factors include your age. So binge eating usually mostly happens in late teens and early 20s, but it can also happen really at any age. But late teens and early 20s is usually the highest risk people for having this disorder. Also, let's look at the complications of this disorder, some long-term complications if it's left untreated. Poor quality of life, obesity, feeling bad about yourself and your life, which, could lead to a long-term disorder of depression, social isolation, medical conditions related to obesity such as joint problems, heart disease, type 2 diabetes, gastroesophageal reflux disease, which is GERD, and some sleep-related breathing problems. So there's definitely a long list of complications and long-term health consequences that are attached to this disorder. So, one wants to get treated quick before all these complications start to occur. It's all about prevention. And going on to prevention, a couple things I found on the Mayo Clinic website was to foster and reinforce a healthy body image to people who may have the binge eating disorder, and talk with your pediatrician. So it can happen at a young age too, and just talk with your doctors about this because they're knowledgeable people who have went to school and studied a lot about eating disorders and just can give a great amount of helpful advice. So diagnosis can be through a physical exam, a blood and urine test, a sleep disorder center consultation, and also can be done through a psychological evaluation. Going on to treatment, the goals for treatment of binge eating disorder are to reduce eating, binges, and then necessary to lose weight. So the treatment is focused on reducing, the time when you binge, that the gaps will decrease, and that the goal is you will end up stopping to, binge and eat normally. Treatment may address shame and poor self-image. So, it can do that through psychotherapy and medications to help fix shame and poor self-image, to help you gain a better image of your body and of who you are as a person. Also, lifestyle and home remedies, which I found could be helpful, is to stick to your treatment, avoid dieting unless supervised by a physician, eat breakfast. That's definitely important. I'm definitely a big breakfast guy, so I'm definitely a strong advocate for eating breakfast because it really sets you up for success throughout the day. Because if you eat breakfast, then you're less likely to eat a lot throughout the day, because if you don't eat breakfast, you're more likely to eat more for lunch and eat more for supper and try to justify that, saying that you could eat more since you didn't eat breakfast, but you actually end up eating a lot more for lunch and supper than if you would have just eaten breakfast in the first place. So definitely eat breakfast. It's definitely important. And arrange your environment, so make sure you have an environment where, you're not seeing things that trigger you, like donuts or pizza or, food that is comfort food that binge eating people usually go towards. And get the right nutrients, get your vegetables, get your fruits, get your protein, carbohydrates, and, make sure you're drinking enough water in the process. Get active. Staying physically fit is definitely crucial because it helps you, in an abundant amount of ways. It helps your heart, it helps, your lungs, your body, helps you maintain your weight, and it just keeps you healthy. And stay connected. That's definitely important, to stay social. Have people in your life who can continue to build you up and keep you accountable in, trying to meet your goals and what you would want to see from yourself, and try to find positive role models in that as well. And also, some more things I found for treatment is taking dietary supplements and herbal products, look for positive role models again, go to a doctor, and maybe participate in a mindful eating program, which has, showed that it can help people with binge eating disorder. And an interesting fact, going back to being social, is typically binge eaters isolate themselves and eat large quantities of their favorite food. So if they're in a social setting, then they're less likely to do that. So the key is make sure you get help, seek treatment, and seek doctor supervision through this if you know that you're experiencing symptoms of a binge eating disorder, and understand that, you're not, weak if you seek help, but that's something that is fine and you're supposed to do, because if you break an arm, you're going to go see a doctor. And same thing with me, freshman year of high school, I broke my ankle. I just didn't sit there and say, hey, this is going to fix itself. I got help and it healed and it recovered. So definitely seek doctors and seek their advice, opinions, and input, and get help and make sure you conquer this not by yourself, but with multiple people around you. So that's binge eating disorder and all it entails. Thanks.